Hi, my name's Tony Waller, and I am making this video on behalf of my class, Nursing Ethics. And what I'm going to be discussing today are nursing ethical dilemmas and my personal responses to them. So welcome, and let's get started. So what exactly is a nursing ethical dilemma? And for me, that is it's a dilemma or an argument that doesn't have an easy answer or doesn't actually have a correct answer that works for everybody. There is no absolute right or wrong, but we have to take into consideration our own personal values and morals and experiences when making the decisions in relations to these ethical dilemmas. The first one I'm going to discuss is going to be hard for some people, and for some people it's clear-cut, and for others not so much. And that is the pro-life versus pro-choice argument. When making a decision about this issue, many nurses have to rely on their personal morals, values, and historically their experiences in life. And that's not easy to do. The arguments may sound simple, but the issue itself is extremely complex. So on the pro-life issue, you have the argument that every life is sacred and that the unborn children are innocent of any wrongdoing, and by having an abortion, you're actually taking or committing murder, and that is hard for some people to swallow. And on the pro-choice side of things, you have the argument that the fetus cannot survive outside the womb, and that women ultimately have the authority or the autonomy over their own bodies. My argument on this, or my view on this, is governed by my relationship with God, and I do believe that abortion is wrong. However, there are circumstances such as incest or rape where that might be a choice that needs to be made by the woman, and as a nurse I would support her in that decision and make sure that she has all the information that is afforded to her to make an informed decision, because as many of us know, abortion isn't the only option when you're confronted with these situations. But as a nurse, I would be a strong proponent of people making those decisions before they're in the situation where they would be confronted to choose either abortion or other choices in that manner. I would like to support young women and young men in being responsible with their sexuality prior to finding themselves in a situation where they could have to be potentially faced with that decision. And so again, not an easy answer. No right answer for every situation and every time. So that is why it is an ethical dilemma, and that's why people struggle with that topic. The other topic that I want to discuss with you is freedom versus control. And as nurses, we see in nurses in our current healthcare, we see the results of people who have had too much freedom and who have practiced too much freedom, whether it's the diabetic who's getting their necrotic toe amputated, or it's the alcoholic who's in end-stage liver failure because he failed to quit drinking. So the question becomes, as a healthcare provider, how far do we allow people's personal freedoms to interfere with their personal health and safety? And again, there's no right or wrong, there's no absolute right here. The need for self-governance and personal autonomy has to be respected in every single person as a nurse. However, we also have to have compassion, and we also have to remember that it's not only personal freedom, but it's also the responsibility and societal issues that need to come into place when you're making the decision about this particular topic. So, for instance, should a person who continues to have their diabetes be out of control and or a person who continues to smoke, or a person continues to drink, should those people be allowed to receive organ transplants? And the answer from my perspective is no, because there are people out there who want to engage in healthy behaviors and healthy lifestyle that will allow them to go forward and lead a successful and healthy lifestyle. Whereas the taking a healthy organ and transplanting it into a person who's going to be physiologically or psychologically abusing that organ is, to me, an irresponsible choice as far as a healthcare system to be making. So I value people's autonomy to do with their health as they please. However, I think that when their health impacts other people, then that's when we as a healthcare system need to step in and lay some ground rules out on that. Again, another dilemma, not an easy choice, not an easy answer, but again, my views and my personal experiences have helped me to make that decision. Does that mean that I would not be, does that mean that I will be unsupportive of a person who has alcohol addiction, or a person who is a diabetic who's out of control? Absolutely not. I understand that these are byproducts of minds and spirits that are not whole, and so as a nurse I would be ministering to their mind and their spirit and hopefully encouraging them to make the right decisions, to get the information they need, and to support them in engaging in making healthy decisions. And that would be how I would answer that question and solve that problem in my own. Another issue is truth-telling versus deception. I actually had an experience with this working in an emergency room late one night. We had a lady come in who was in the late stages of brain cancer, and she was suffering quite horribly, and she had not told her family that she had brain cancer. And so when they arrived in the emergency room, it was very difficult for the staff to interact with her and her husband because she hadn't revealed the whole truth to her husband. And in that situation, I helped to facilitate the conversation she had with her husband and her, and she was just really afraid of her husband seeing her as weak, and there were some cultural nuances that came into play there, and she was really distraught about having that conversation with her husband, and it was agonizing from a standpoint of a nurse, because for me the simple thing would have been to get the family support and to have that, but the cultural sensitivity in this issue was of utmost importance, because for her husband to see her as diseased would have been the end of her personhood, and I had to respect that. And we facilitated a conversation between her and her husband, and it was as positive an outcome as it could have been at the time. And another experience that we see with this is the family that doesn't want the patient to know just how sick they really are, fearing that it's going to decrease the fight or decrease their effort to pursue more treatment to get better. And we have to really sum up the situation and do what's right and best for the patient. And sometimes in those cases the family members are right, that once the patient hears just how sick they are, they do lose the fight. However, as a nurse, I believe that we need to give the patients the accurate and honest information to make an informed decision about their care and how to proceed forth, and then we need to support the patient and the family in making that decision and carrying it out, no matter what it means for us personally. as nurses, and those situations can be extremely exhausting, and we can enter into extreme episodes of moral fatigue and caregiver exhaustion. Those are the situations that cause nurses to really go home and just really be upset and angry and push people out of the profession. So we have to be mindful of the patient, we have to be mindful of the family, but we also have to be supportive of one another in dealing with these ethical dilemmas. One of the, as an emergency room nurse, one of the ethical dilemmas that I am faced with on a routine basis is the distribution of resources. As an emergency nurse, we can't refuse care to anybody, and so you have to ask yourself, when whoever walks through the door, how much care are you going to be responsible for giving to them? And is it going to be financially feasible? Is it morally feasible to do that? And is it ethically feasible? If you have a person come in who is dying and it's obvious they're dying, is it responsible to exhaust every effort on the care of that patient, including CPR, medications, shock, drugs, intubation? Are those central lines? Are those things responsible to do? Are those things beneficial to the patient? As emergency room nurses, it's hard for us to step away and say, you know, no, those things aren't good for the patient. They're not good for the family. They're not good for anybody around. They're not good for us as caregivers, because we experience that medical futility over and over and over again, and it's demoralizing to the staff. It's demoralizing to the patients' families. And so I would hope that someday we can, even in the emergency room, embrace a culture of respecting end of life and being supportive of it. I would really like to see more efforts being done with the patients prior to getting to that end of life stage, so that they're aware of exactly what does it mean to exhaust, to make these heroic medical efforts in taking care of them. What does a code really look like? What happens? And for them to understand not only the financial burden to the loved ones left behind, but the emotional trauma that they go through watching their loved one being coded for 30-45 minutes. What does that look like for them as a family member? And so then they can make an honest decision about that. And then once again, do we utilize the resources the same for everyone? We should, we want to, but is that realistic? Can we continue to do that as a healthcare system and stay viable? For me as a nurse, it means everyone gets mediocre care, or some people get really great care. And what does that mean as a nurse? That is really exhausting emotionally and morally and ethically for me, to not be able to give the same consistent care to every single person that walks through the door. Whether the reason is financial or overwork or other reasons, that in and of itself is just really a ethically demoralizing battle that we fight every single day, because we would like to see everybody have access to great care. But the truth is not everybody does have access to great care. And that's actually one of the reasons why I'm deciding to go in and become a nurse practitioner, is to service those underserved populations and give them the same level of care that they would get if they were a millionaire. And that's what that's what I hope to give, and that's what I hope to do, and that's the legacy of nursing that I want to leave to my patients. And that's the example I want to set for my children, and I'll open up for questions now. Are there any questions? Okay, one of the questions that's been raised is how do we give million-dollar care in a country where the population is becoming more and more increasingly overwhelmed and out of control? And that's a really good question. Recently, I've been confronted with several patients who have recently either had to change the insurance because of the new healthcare reform law or have lost their insurance all together. And these were people who were actually engaged in health-seeking behavior that would have been beneficial to them and to their families, and was actually entertaining a quality of life that was acceptable to them and their families. In one situation, I had a gentleman who had to change all of his cardiac medications to lower cost ones, even though he had been on the same medications for the last 5 years without deviation, with good results. And so as a nurse, ethically it was reprehensible for me to have to tell this patient that there was not really any good solution to help him afford the exact same medications that he had been on. And so what we ended up having to do was we've had to end up substituting less expensive medications for the one he was taking. And so as a nurse, I felt really torn by that, because I'm sending a patient out not knowing how he's going to respond on these new medications, not knowing if they're going to be beneficial to him, if he's going to react negatively to them, if they're going to continue to enhance his quality of life or take away from it. And so that was a tough decision as a nurse. Not decision, but it was a tough concept to have to wrestle with, because I knew the right thing would have been that the patient should have been able to stay on the medications that he had been on for the past 5 years without any problems, but financially, and I couldn't find any alternative for him to be on those medications without an increased cost. Great question. I just had the question at the end of life, how as a nurse do we deal with the conflict within a family member between the patient who doesn't want any more heroic measures done to sustain their life versus the family member who is having a difficult time grieving and letting go of their family member and who wants everything possibly done. And once again, there is absolutely not an easy answer. I've had two situations. One was a daughter who absolutely could not come to the terms that her mother was dying, and it was really difficult, and she wanted everything done for her mom, and the mother felt such a terrible sense of guilt for giving up, and so how we responded from a nursing perspective is I sat down with the daughter and the patient together. We sat down all three and we talked about the concerns, and I let the daughter verbalize her concerns on, you know, how her life was going to go on without her mom, and how what that meant for her, and the feelings over, you know, loss and grief that she had. And then we went through the process with the daughter of getting resources that she can go to for help, and talking with those things, talking about those issues that are really difficult for her, which was, you know, the fear of abandonment. She didn't want to lose her mom. She felt, you know, that was her mom and she loved her, and that was really difficult. And then we had a situation where we had a patient who absolutely, you know, had wanted to let go so bad, but the family member was just adamant that they were not ready for that. And in that situation, no matter how much we tried as a healthcare team to confront the daughter and to support her, she just wasn't hearing it. And so in that situation, we worked with the patient to understand that her daughter just wasn't emotionally ready to let go. And so we supported the patient, and we supported the daughter, the family member, to to the point where the daughter was ready to let go and could let go of her mom in her suffering and be there and support her. But above all things, no matter what, the main thing is to respect the patient's choice. It's the patient's choice that has to drive everything. My job as a nurse is to make sure that each person feels supported and each one of them has the information they need to achieve their healthiest outcome, whether it's physically, spiritually, or emotionally. And that's my role as a nurse, and that's my role as a nurse practitioner is to make sure everybody has the information they need and support them in their decision no matter what. And also be mindful of how my own personal feelings may be interfering or assisting in the process, and to keep those in check. Okay, so another great question. So the question is if a person came to me expressing the desire to have an abortion, stating they just really needed to have one, they had made a mistake, and where could they go and what could they do to get one? Boy, this is a tough question for me. I do believe in God, and I do believe that abortion is absolutely wrong. So for me to support a patient in this situation, I would have to work really hard to keep my own perspective in check. And I would, first off, I would try to talk with the patient about what had brought them to this situation, because a lot of people don't understand that there are emotional and there are spiritual and there are physical consequences to having an abortion. Many women who have had abortions later on down the years report a tremendous amount of guilt and a tremendous amount of regret at having done that. So I would want not to shame the patient, but to educate them about the different options that they had, and where to find help. And in this situation, if the person were adamant on having an abortion, at that point I would have to recuse myself from that situation and have another nurse handle it, because I just feel very strongly that it is wrong, and it goes against my personal spiritual beliefs. I've not been faced with that situation before, and I would not, be in the intent to talk somebody out of having an abortion, but I think that the main thing is that they know all the choices, and that they feel supported in making their decision, and they know the potential consequences for that decision, and that they know that there's support and there's help out there if they don't choose that option. And so, but I could never participate in an abortion, and I could never condone or direct somebody to do that. So that's the end of this little video. I hope that this allows each one of you to get to know me a little better and where I stand on some ethical issues. I am excited about this class, and I'm excited about this program, and I look forward to talking with each one of you more. And in closing, I just want to remind you that in ethical dilemmas, there is no right and there is no wrong, easy answer. They're all tough. They're all going to be tough to decide. And as long as you're thinking about them, you're growing. And so, bye.